because back in the 1990s we weren't really aware of the analgesic and anti-inflammatory effects, and I asked him, how come we're getting this effect? Because we thought it was a wound healing treatment back in the late 80s, early 90s. And he said, well, when I was doing the ward rounds and meeting the patients after surgery, he said I could tell exactly which ones had a laser treatment and which had a placebo treatment, because half of them had no edema around the wound. He says, I think it was just less pulling on the stitches, therefore there was less pain. Well, now we know we have anti-inflammatory and analgesic actions as well, but yes, it is anti-edematous. So this patient here has had a skiing accident, had a fractured clavicle, got a plate on it, gets home 3 days later to see his wife, who's a dentist who uses our product. She put the LED treatment over his scar tissue here, and you can see all the edema around the wound, and later that day, it's all gone. How cool is that? But far more difficult than post-traumatic or soft tissue edema is breast cancer-related lymphedema. Here they're measuring the circumference of the limb, and the greatest reduction, a greater reduction occurs in the active laser treatment group compared with controls. So they are treating lymph nodes in the axillary area and antecubital fossa as well, and then inflamed areas. But you can do it for head and neck as well. And so they're getting improved reduction in lymphedema and improved shoulder abduction, improved shoulder flexion, and improved grip strength as well. And a systematic review of the literature looking at these treatments says there's moderate to strong evidence the effectiveness of low-level laser for the management of breast cancer-related lymphedema from 5 small studies of acceptable methodological quality. Now, an experiment on some rats, I photographed this